Good day everyone, I'm nerandi Gamage from group 25. I'm going to talk about suicidal precautions in this video. So there are suicidal levels. First let's see routine precautions. So in this, patients who are not presently voicing suicidal ideations or not presently exhibiting clinical symptoms that suggest intent or plan to self-harm will receive routine precautionary care. Now let's see precautions. First, an assessment will be performed by a registered nurse on admission with documentation of suicidal precautions, and then the registered nurse will notify the physician immediately of any suicidal attempt or any changes in the patient's condition, behavior that indicates a plan or intent for self-harm, and the routine unit precautions will be observed. Patient rooms, day rooms and dining room will be assessed daily for harmful objects. The patient, room and belongings will be assessed on admission, and any sharps or substances that could be harmful to the patient will be removed. The physician will evaluate the patient's condition and indicate the appropriate level of precautions. Documentation of routine observation will be made in the progress notes for psychiatric patients. Observations of the critical care patient will be done in the critical care flow sheet. So now let's see level 3. In this, patients with suicidal ideations who after an assessment by a physician present clinical symptoms that suggest a possible for self-harm but no plan for acting on that intent. Example of patient symptoms in level 3. The patient who has made threats of self-harm but has no plan is willing to make a no-suicide contract. Now let's see the precaution. The registered nurse may place the patient on level 3 suicide precautions until receiving a physician's order. The RN will document in the patient progress notes the date and time that precautions were initiated. Observation of the psychiatric patient will be documented every hour on the observation record. The patient will have constant supervision by staff during meal times. A physician's order is required to decrease or change the level. Now let's see level 2. So in this, patients with suicidal ideations who after an assessment by a physician present clinical symptoms that suggest a clear intent of self-harm but a vague plan for acting on the intent. Example of patient symptoms in level 2. The patient who is ambivalent about making a no-suicide contract and continues to talk about self-harm. So the precautions are, level 3 precautions will be taken. In addition to the following, the registered nurse may place the patient on level 2 until receiving a physician's order indicating level. Observation of the psychiatric patient will be documented every 30 minutes on the observation record. Now let's see level 1. So in this, patients with suicidal ideations or delusions of self-mutilation who after assessment by a physician present clinical symptoms that suggest a clear intent to follow through with a plan or delusion. So patients that make a suicidal gesture while hospitalized will be placed on level 1 precautions. Example of patient symptoms in level 1. The patient is currently verbalizing a clear intent to do self-harm, has a concrete plan to commit suicide or has attempted suicide in the recent past by a particularly lethal method like hanging, guns, carbon monoxide, a potentially lethal overdose confirmed. Now let's see the precautions. Level 2 precautions will be taken. In addition to the following, the registered nurse may immediately place the patient on level 1 suicidal precautions until receiving a physician order indicating the level. If necessary, the nursing staff will provide first aid measures when appropriate. Observation of the psychiatric patient will be documented every 15 minutes on the observation record. The patient will have one-to-one observation during meal times. A one-to-one order may be obtained for constant observation of the patient. While on level 1 precaution, the patient's absence from the department will be limited to medically necessitated escorts to other areas of the hospital.